Welcome to Critical Health News' weekly video Bright Bite with Pharmacist Ben Fuchs. Hi Ben, how's it going?
It's going good, Jonty. Good to see you again.
Well, today I think we're going to talk about one of the biggest killers in the world, by my understanding, if not the biggest. Is it the biggest?
Number one in the world, number one in the United States. 300 and maybe almost 400,000 people a year die of heart disease. As far as heart disease goes, it's a secondary health issue. It's not a primary health issue. It follows other breakdowns in the body, primarily something called metabolic syndrome, which is a blood sugar problem. In fact, that's probably the number one cause of heart disease is blood sugar issues, insulin issues, diabetes issues. You know, we talked yesterday about the absolutely horrific numbers when it comes to diseases. 100 million people have diabetes, and 50 million people have arthritis, and 30 to 40 million people have autoimmune diseases, these ridiculous numbers. And heart disease is a classic example. I think the latest statistics I read are something like, 85 million people are dealing with heart disease. It's a secondary problem primarily following blood sugar issues, so-called dysglycemia, which is messed up blood sugar. Dys meaning messed up, glycemia, blood sugar. Dysglycemia, messed up blood sugar. In fact, doctors will tell you heart disease is a manifestation of something called metabolic syndrome. Metabolic syndrome is a complex of symptomology. That's what a syndrome is, a bunch of different symptoms that come together. And metabolic syndrome includes things like hypertension and heart disease and kidney disease and blood clotting issues, circulatory issues. Alzheimer's disease is now thought to be part of metabolic syndrome, or at least it's type 3 diabetes, they call it. All of these follow messed up blood sugar. Now, when you think about how we eat, it makes perfect sense that we'd all be suffering, or at least 1 out of 3 Americans would be suffering from dysglycemia, from messed up blood sugar. Sugar represents a major toxin to the body. Yes, it's true you need a small amount of sugar in the blood, but after that small amount of sugar, the body has to process it and take the sugar and stash it away. And what doesn't get stashed away creates these miniature explosions inside the circulatory system, inside the blood vessels, and it can't help but lead to circulatory issues, including heart disease. So what does this mean? If you don't want heart disease, or if you have heart disease and you want to reduce the symptomology, if you want to improve the condition, watch your blood sugar. That means all of the things we talked about when we talk about diabetes. Diluting your blood sugar by drinking water, making sure you're using generous amounts of the B vitamins, especially vitamins B1 and B3, niacin and thiamine, which are your major blood sugar metabolizing B vitamins, vitamin C, electrolytes, essential fatty acids. There's a whole spectrum of nutrients that you can use to help stabilize blood sugar. Of course, reducing your intake of sweet foods. And it doesn't have to be sweet foods, bread and pasta and potatoes, which you don't think of as necessarily being sweet foods, but they will induce or increase the likelihood of dysglycemias, of messed up blood sugar. If you can't wean yourself off of sugar, if you're a sugar addict, and that's very understandable because sugar has this addictive quality, there are nutrients that you can use to help make it easier to get you off of the sugar. Protein, for example, specifically an amino acid called glutamine, can be very helpful. Essential fatty acids in general can be helpful for helping you wean off of sweet foods. There's a nutrient called alpha lipoic acid that can be helpful. Selenium and sulfur, 2 very important minerals that can help. Not so much for helping you wean off of sugar, but helping you process sugar. Zinc is a very important mineral for helping you process sugar. And zinc deficiencies are very common. Magnesium, another very important sugar processing mineral. Another major strategy for dealing with heart disease is, of course, we talk about this all the time, working on the digestive system. Once the digestive system begins to break down and you get holes, literally get leaks in the gut, in the digestive lining, and toxins go into the blood, well, then your blood thickens, and then it makes it difficult for the heart, makes it harder for the heart to pump. And again, these are things that can put a burden on the heart, and that can increase the likelihood of a heart attack or heart disease or strokes or cardiomyopathy or anything that has to do with the circulatory system. So focusing on the digestive tract, using probiotics, good bacteria, using fermented food. Anything you could do to support bile Bile is the body's fat processing liquid. It's like, they call it a detergent, a biological detergent. It helps break up fatty substances, but it also acts as a detoxifying substance. So bile helps clear out excess drugs. Bile helps clear out excess hormones. Bile, when it becomes sludgy, can clog up inside the liver, lead to liver disease issues. It can make the blood stickier. It can cause gallstone problems, and it can mess up your digestive system. It can lead to toxicity in the blood. So working on bile is very helpful. Digestive enzymes in general can have a blood purifying effect, and many digestive enzyme supplements, including the Ultimate Enzymes from Longevity, come with bile. So using your Ultimate Enzymes as a digestive aid to get the bile benefits of the bile and to get the digestive benefits, but also as a blood purifier. If you take your Ultimate Enzymes on an empty stomach, they can act as a roto-rooter, if you will, for breaking up clogs inside the blood. And that's taking your digestive enzymes on an empty stomach. So miscellaneous nutrients, now not really miscellaneous nutrients, but they can be helpful. Vitamin C may be the ultimate cardiovascular nutrient. In fact, there's many people who believe, many physicians, many naturopaths, many alternative practitioners who believe that heart disease is actually a manifestation of vitamin C deficiency. Scurvy, for example, or subclinical scurvy may be associated with heart disease. There's a guy named Dr. Matthias Rath who actually wrote a book called Why Animals Don't Get Heart Attacks. And in this book, he uses the fact that animals make their own vitamin C and typically don't have heart disease as proof that there's a relationship between vitamin C, or lack thereof, and heart attacks. So using vitamin C can be very helpful in high doses. Of course, your Beyond Tangy Tangerines loaded with vitamin C. Vitamin E is a really important cardiovascular nutrient. If you're not supplementing with vitamin E, it's very difficult to get vitamin E from foods. So making sure that you're getting 400 international units of vitamin E a day, especially if you're using essential fatty acid supplements. EFA supplements will typically have a little vitamin E in it, but it's a good idea to take a little extra vitamin E. And vitamin E is one of those tricky ones. There's 8 different kinds of vitamin E. So if you really want to do vitamin E right, you want to make sure that you're getting at least 4 of them, but ideally 8 of them. 4 of them are called tocotrienols, and another 4 are called tocopherols. And if you really want to do vitamin E right, you want to make sure you're getting your tocotrienols and your tocopherols, but at the very least, make sure you're getting alpha tocopherol, which is the main source of vitamin E, 400 international units a day or so. There's another stupendously important vitamin for the heart. It's not an essential nutrient, but it's very important for the heart, and it's called coenzyme Q10, which you may have heard of. And interestingly, there's a kind of a special connection between cholesterol and coenzyme Q10. It turns out that the same chemistry that the body uses to make cholesterol, it also uses to make coenzyme Q10, and when you take a statin drug for your heart to suppress your cholesterol, you're also going to suppress your coenzyme Q10. So if you are going to take a statin drug, and I don't want to digress on the absolute silliness of that class of medication as far as health goes, but if you are going to take a statin drug, it's very important to make sure you're taking a little extra coenzyme Q10 with it, because you're going to be suppressing the production of this really, really important cardiovascular nutrient. And then another nutrient that you don't hear a lot about that also has some benefits for the heart is carnitine. Carnitine is helps the body utilize fats for fuel, and it can help energize the heart. Carnitine deficiencies can cause problems with heart energy, and there's actually a really cool book by a guy named Steven Sinatra. I forgot the name of the book actually, but he talks about acetyl L-carnitine, which is a specific kind of carnitine, acetyl L-carnitine, as a treatment for heart disease in association with coenzyme Q10 and magnesium. We mentioned magnesium a little bit earlier in terms of helping the body process sugar, but magnesium is also a very, very, very important cardiovascular health nutrient. And then a couple miscellaneous things that may be helpful for the heart. Vitamin K is important for calcium metabolism. It can help attract calcium or keep calcium in the bones, prevent calcium from leaking out into the blood. And then vitamin D, another very important nutrient for calcium metabolism, and vitamin D deficiencies are very common. The best place to get your vitamin D, of course, is the sun, but if you're going to supplement with vitamin D or eat your vitamin D, make sure you're using maybe 5,000 or so, anywhere from 3,000 to 5,000 international units of vitamin D3 a day. And then foods that contain vitamin D are going to be mostly animal foods. I think on one of our programs, by the way, I mentioned olives as a source for vitamin D, so that's not correct. I misspoke on that. I got a couple of letters about that, and want to correct that. Let's see if there's anything else here. Vitamin A, you know, your general mighty 90 essential nutrients are going to be important. But if you want to pick a few major strategies for dealing with heart disease, surprise, surprise, number 1, focus on blood sugar. Number 2, focus on digestive health. And number 3, it's very important to relax the body. Under conditions of low blood oxygen, when the body's under stress, it's going to change the circulatory system. It's going to put a stress on the heart. So by relaxing the body, slow deep breathing, oxygenating the blood, activating the rest and digest nervous system, the parasympathetic nervous system, you can reduce the load on the heart, sometimes dramatically. I mean, we don't often talk about this, but heart disease, in addition to being the manifestation of metabolic syndrome, is also the manifestation of excessive sympathetic nervous system activity. The sympathetic nervous system is your fight or flight nervous system, and under long-term chronic fight or flight nervous system activation, heart disease is more likely to occur.